care about this. I mean, you can leave it on if you want. The idea, it's more of the original Chinese medicine type thing.
Photos, I reckon.
Of creating some sort of, it's like a magnet, and it creates counter pressure. It comes off or on. So this is the little suction gun. Essentially, place it on the skin.
Yeah.
This goes over 2 pumps or so. General rule of thumb, what I was taught is like no more than like halfway up the length of the cup is probably a good amount of pressure.
Just one black.
Yeah, let's go.
Always just talking to your patient though, you know, especially someone new, it can be kind of intense. So that suctions it on. To release it, you just pull the little stopper and the air will come out.
Okay.
Okay?
You pull.
Little pull. Yeah, and like sometimes like when you get good, they're a little bit tricky at first to get used to. But like I know people that would overpressure a little bit and then release to the point that they wanted it. You know, especially if you're doing the sliding, it's hard. It takes getting used to get the right amount of pressure so that it will still have suction, but also be able to move it. So you can kind of try to play with the stopper to get it at the right level. This is for self-use if you want. It just goes over the gun. Yeah. Yeah. If, you know. Sure. Yeah, okay.
Maybe later.
Yeah. Go ahead and go sideline.
Right.
We'll just do a stay one to start so you can feel it. So you're pretty tight there. So it's, you know, it's pretty stationary. Yeah. You okay?
Yeah, it's fine. It's weirder than I thought.
Yeah. So the stay, like you said, that you would just leave it on for 10 minutes, and of course, like, you know.
So you just want to get it up to that.
Yeah, you were. This is a tighter area, and like again, depending on where you are, like pretty surface level, where connective tissue is right there. We're not gonna get, but like if you do it like on the calf, an area with more, you know, already movability, but you can already see it starting to kind of get the blush going. Yeah. You know, and so here I'm like, oh, eyes, how do you feel? And you're like, oh, I'm okay. And I'm like, okay, you know, let's.
Oh, you're kidding me.
Yeah.
How are you doing? Not good anymore.
Yeah. And so.
Anyone we don't like.
Yeah, do that. Yeah.
Wow, that's.
Or have them actively do it, and that's a good way to do it too, because then they can do it to their tolerance.
Yeah.
You know, you're not going to push them more than
like
they're willing to go.
What I would call pleasant right now.
Yeah.
Does it get pleasant with time?
You know, IT band is a tougher spot. Like,
but after 10 minutes.
Everyone look. Perfect. That might go online. We'll do that in the go.
But after 10 minutes, how does it feel? Still the same as in the beginning, or does it like decrease the feeling?
Yeah, that's a good question.
And you'll see people even that will do stuff like that, that will play with it. Like, even if you're not sliding it, if you're like,
oh, you're still like
just gently, like kind of manipulating it a little bit to get, you know, that tissue to move somewhat.
But that's good. We don't really like too much just leaving for 10 minutes, so we can.
So you got and like, especially like I said, if you have somewhere else you need to treat, like great. You know, but, and you know, if I was really treating eyes here, I'd probably do a series, especially like, you're gonna leave it to stay, hit them with like
so how do you adjust that?
So again, you kind of have to, so you had so much suction on there. It's partly playing with them, and it's partly because they're new. That's all good. Yeah, you can kind of like hit it to the side a little bit to try and get it to come out.
Look at that. It's already red.
Got a nice little.
Oh, don't go and gloat now. Look at that.
Yeah. I got it.
Yeah, that's cool.
So we can try a slide.
Can we try?
Go face down. We'll do calf. Is usually.
Okay.
We'll probably get a good amount of.
So because of how tight it was, that wouldn't be the best.
No, and like you could try. You're just gonna have to play with the pressure and, you know, like how much. Because you'll see, it's easier when you can get more tissue into the cup to move it.
So you put a bit of lotion?
Yes, absolutely.
You better record, I can't.
And like general lotion will work. Yeah. nice and slow.
Yeah, it's not pleasant, but I can see how it works.
And then, ooh, yeah, like then now we're not moving anymore. So maybe that's all I move it is back up. And it's like, oh, it's too much for him. Okay.
Yeah, it is a little bit. So you
And
can,
then
you can
I'll take a little bit out.
So you just released it.
I just released it just a little bit to take some off.
That's so cool.
Yeah, now we're moving a little bit better. How is it feeling?
Yeah, it's much more.
Okay.
Yeah. I can feel like it's still. I reckon there's some sort of fascial. You know.
Yeah, because again, it's like any instrument, any tool. It's not necessarily the same feeling you get with your hand itself, but it will give you some feedback where like we're moving, and then I'm like, ooh, I'm getting, I'm having a harder time moving it there. How are you feeling?
Yeah, that's fine. Yeah. The one before was like, ooh. So it was that in between. Yeah. So if it was, I'd probably try a little bit. Yeah.
Yeah, and that's the thing. And you have to. Everyone's different. Every area is different. So you just have to play with it, and it takes some getting used to. Don't be surprised the first time you grab the cup and you try to adjust it. It's just like, and you lose all of it. But that's generally it. And then cleaning wise, of course, get the medium off. We would use like a little alcohol swab or just like a wipey after people. But how does it feel? You okay?
Yeah, it was fine.
Yeah.
So yeah, just remember with that too. So we have plenty of alcohol swabs. Make sure that we get it nice and clean. We can have some separate stuff.
Let's see how.
How's the other one?
No, the big one, yeah.
So that'll last a few days. So some areas in particular, like the cups for, I mean, you can use it anywhere, but like upper really trap's cool. A good one, and the slide one's good for that. Just like sit in here for a second, or like, that lateral epi type stuff. Yeah. Like it's just kind of nice. Mm-hmm. But there's no limit really.
Cool.
Again, anywhere you feel like a little crackly, like you see it a lot along like here. Yeah.
So you just got to play. So literally, we'll try and supervise. So it's literally on there, and then boom, boom.
And obviously the size of the muscle, there's the different sizes of the cup, and it's even just client.
It's a perfect thing because I like with when I do my dry needling, I'm not someone that'll needle like everywhere.
Everyone, right?
I just want or everywhere. I'll just pick a little area to go.
Yeah.
So I like the idea of not using too many cups. But actually being specific.
Yeah, and I figure, 12...
You soft cups, so you just literally...
Yeah, literally, I was telling you the other day, because I wanted to, like, practice it. And I think these are just, and I'm not sure, this is just a replacement.
I guess you just take that out.
Yeah, so I think this just goes, like, in there.
Yeah.
Right?
Does it extend it?
It just extends it, so that you can... Because I can, like... you can get on your own leg or your own hand, but if you wanted to do, like, your own upper trap or something...
No, let's not do it. Kick it in there. Oh, you know what?
Yeah, I have a couple of marks because I was like, oh yeah, okay.
That's so cool. And then
you just take that off. Yeah.
That was too much. I got it. Oh, I'm gonna have fun with these.
Yeah.